had to ring for scans, and they said to me, look, ring your McGrath nurse, so you've got, your anxiety's not going off the chart. She can tell you your results, blah, blah, blah. I had an oncologist say, do not do that. Because what happens when Jane says, oh, they're not as good as you thought they were going to be, you need to bring a support person when you come in and see Anna. Do you sort of get resistance from oncologists to say, don't ring your McGrath nurse, just in case it is bad news?
There might be a couple of different things going on there. Probably within our scope of practice as a nurse, it's not usually our role to deliver scan results before the doctor has. We can discuss them afterwards and interpret or work with someone to go through them. But and the idea around that is not because they're the doctor and we're the nurse. It's around the fact that the doctor can, I suppose, allay fears by talking about the other treatment options. I work with, I've got 2 oncologists that I work with very closely. If I'm going to give scan results at all, I do always ask them first. It's always a tough thing when you know someone's going to get some, bad news, to not sort of ring and say, bring in that support person. Because you don't want to do that to someone. You want to be able to have them there with a support person, but you also don't want to have them sitting for 2 days wondering, or a day, why are they saying to me, bring a support person? Because it's a tricky situation. Sometimes the doctors are happy for us to say, look, these are the results, but we're going to get you in tomorrow to chat about what's going on. Bring someone with you, because you do need that second set of ears sometimes. What we do varies probably, and we try to just do the best thing for your emotional well-being at that point in time as well. We're not counsellors, but we do have some basic counselling skills, and I think the trick for us is always recognising when people need a listening ear, and when they need referral on to a professional counsellor like a social worker or psychologist. And really often it's just asking people how they're going and listening, and just really giving that opportunity to voice their emotions and asking them what they would like. So it's supporting each individual person to get the support they want at the right time in the right place. That might be going through their GP to see a psychologist or a counsellor, because that's close to home and they don't have to catch a bus into PA hospital, or it might be a phone counselling service through the Cancer Council Queensland. It might be joining a support group, and this wonderful resource that Mary and Pia offer.